Physio Control Lucas 3 chest compression system operations for pre-hospital use. This is a demonstration video. Refer to the instructions for use for complete directions for use, indications, contraindications, warnings, precautions, and potential adverse events. All chest compressions in this video are simulated. The Lucas 3 chest compression system is to be used for performing external cardiac compressions on adult patients who have acute circulatory arrest as defined as absence of spontaneous breathing and pulse and loss of consciousness. Lucas must only be used in cases where chest compressions are likely to help the patient. The Lucas 3 device is intended for use as an adjunct to manual CPR when effective manual CPR is not possible. Deploying the Lucas device. Remove the Lucas 3 from its case and turn the device on by pressing and holding the green power button for 1 second. An audible tone will confirm a self-test, and a green LED beside the adjust key will illuminate. Next, remove the backplate and place it under the patient. It is important to minimize interruptions to manual chest compressions while applying the Lucas. Method 1. Rolling. Roll the patient onto one side and slide the backplate into position, adjusting as necessary. Method 2. Lifting. Place the backplate under the head first, then lift the torso and slide the backplate into position, adjusting as necessary. The correct position for the backplate is directly under the armpits, as shown here. Next, prepare to attach the upper part by first pulling, then letting go of both release rings as shown. Attach the first support leg to the portion of the backplate nearest to you, then to the opposite side. Verify a firm connection by listening for the audible click and by pulling up slightly. Use your finger to make sure that the lower edge of the suction cup is immediately above the end of the sternum. If necessary, move the device by pulling the support legs to adjust the position. Proper position is achieved when the pressure pad in the suction cup is immediately above the end of the sternum. Warning: if the patient is too large, the upper part of the Lucas device cannot lock to the back plate without compressing the patient's chest. Immediately resume manual compressions. Warning: if the Lucas device alerts with 3 fast signals when lowering the suction cup and you cannot enter the pause mode or active mode, immediately start manual compressions again. Now, lock the start position by pressing the Adjust Pause button. The Lucas 3 device will adjust the suction cup to the correct start position. After starting compressions, immediately place the stabilization strap. This is a required step and essential to making sure that the pressure pad remains in the proper position on the sternum. Make sure the suction cup is in the correct position on the patient's chest. Some users use a marker to help monitor the suction cup position. If necessary, adjust the position of the suction cup. Warning: if the position of the suction cup changes during operation or during defibrillation, immediately push Adjust and adjust the position. Defibrillation can be performed while the Lucas device operates. Defibrillation electrodes can be applied before or after Lucas is applied to the patient. Warning: chest compressions interfere with ECG analysis. Push pause before you start the ECG analysis. Make the interruption as short as possible. An intermittent LED in combination with an audible signal will alert the operator before each ventilation pause. The green LED signal will blink 10 times per minute to alert for ventilations during ongoing compressions. Care after use and preparation for next use. Remove and install the suction cup. Remove and attach the patient straps. Transmitting data from Lucas 3. Confirm that Lucas 3 is powered off. Push transmit. Lucas 3 remains discoverable for 30 minutes.